Hey everybody, welcome back to my channel. Dr. Dre here, Board Certified Internist. Today we're going to talk about something that we all do. Rarely talked about in the past, but now it seems that everybody's talking about it. What am I talking about? The perfect poop. You know, making brown, dookie draggings, however you want to say it, that's what the topic is today. And it is about the chase of having the most normal poop that people seem to be obsessed about. What makes it even worse is all the fitness gurus talking about, oh, you should have this in your microbiome to make the poop a little bit better, or have this tummy tea. And all these things are just giving people an absolute complex. So today we're going to take a deep dive and find out what is the norm. And at this point, it is everywhere. I'm surprised the Charmin bears haven't even brought up and give you a little bit of poop advice or gut advice. And you know what? It's still early in the year. It totally might happen. And this pursuit of the perfect poop is like chasing unicorns. People are on this unicorn hunt. So all the time in the clinic, I get calls about, I had one episode of constipation, I had one episode of diarrhea, and people are really worried because they're always trying to basically weigh themselves against the norm. So today, hopefully we can level set everybody to know what is normal and what is not. People are meticulously tracking every bowel movement. They're making logs, and not those kind of logs. I'm talking about logging every time they have a bowel movement, checking how much fiber they eat. I've even had to have unsolicited poop pictures for me to analyze if this is normal versus abnormal. Now, I haven't had somebody come in with a Ziploc sample, but again, it could still happen this year. And if it doesn't happen this year, it's definitely going to happen next year. To take it to even more of extreme, we do have patients getting these $10,000 Japanese toilets will give you so much information about your feces and your stool, giving your fiber intake, if there's anything wrong in it, tracking your urine. So, people are going pretty extreme with analyzing their outs. So really this is about people's desire to be in the norm. Generally speaking, in society, people want to be unique, but when it comes to medicine, people want to know that they're within the norm and that everything that happens to them inside their body is part of the norm. And I think this is the essence of this entire video, at least people comparing themselves to the standard and making sure that they're not outside of the standard. So the first thing that kind of will level set everybody in talking about their stools and what is normal and what's not is the Bristol Stool Scale. It's a literal scale. You can print it up. I will show it on the screen, and it gives the 7 different types of stools you can have. If you're in stage 3 and 4, it's usually considered a soft stool, solid piece, maybe a couple cracks in it, but generally normal sausage shape. That is going to be the gold standard. This is the norm that everyone's looking for. If you're in type 1 or type 2, this is going to be stool that is really hard to pass. It comes out in small pellets. It's not sausage shaped. It's extremely small. You could think of like what people call rabbit turds. Inconsistent, you feel like your bowels are not fully evacuated. So that would show that you have constipation. Stages 5, 6, and 7. Now you're getting into loose stools, very watery stools. Basically, when you look at it, it's also runny or it has no form whatsoever. So if you're looking at this and trying to figure out where you are on that scale, again, 3 to 4 would be the normal poop or the normal stool that somebody would have. So why does somebody have these different types of stools? That's the most important thing to understand. And like I said before, having 1 or 2 episodes of diarrhea, 2 episodes of constipation, it's not time to panic. It's not time to run to the hospital. So what can make somebody have constipation? It's pretty simple. Anything that can dehydrate you. So for example, not drinking enough water, having a change in your diet can definitely cause constipation. Not going to the bathroom soon enough. What do I mean by that? So for example, if you were to hold it in for a couple hours before you could pass your stool, your larger intestine basically absorbs water. You absorb more water, therefore the stool gets hard, therefore you might have a hard time passing it. That would be another reason. So like I said, change in diet, water content, that kind of thing definitely leads to that. And then here, when we live in Nevada, being in the heat, you lose a lot of water. Again, same thing, you could have constipation. The last thing I would say is different medications. Different medications can dry you out, but as you can see, all the answers have to do about water content. To go on the opposite side, when we're thinking about diarrhea, the reasons why somebody would have diarrhea, you have infection, your body tries to get rid of it. A lot of people try to rush and stop their diarrhea. Well, your body's trying to expel something that it doesn't want in there. So a lot of the time we just watch it, we manage it, we try to to replete your fluids, but we don't necessarily try to stop, and especially if the diarrhea is infectious. Another thing is, again, changing foods, changing your foods. You're not used to something, your body's not used to it. Medications, you could have diarrhea. One of the most common things that people don't know that would cause them to have diarrhea is artificial sweeteners. Artificial sweeteners are an osmotic agent, so they're pulling water into the colon. So somebody who's now on a new diet, they start having a lot of artificial sweeteners. I had a patient who was having a lot of the sugar-free peppermint patties, and they were having diarrhea all the time. We stopped them from having the peppermint patties, and the diarrhea went away. So again, it's just different things that introduce to your body, but those are the two extremes, constipation versus diarrhea. So where I would say where things become abnormal is when things go into chronicity. So if you have chronic constipation, chronic diarrhea, now it's time to send you to a GI doctor and for them to look it up. Unfortunately, chronic diarrhea is hitting about 4 to 6 weeks. But, you know, if somebody has 2-3 weeks of consistent diarrhea, yeah, that should be investigated. You should go to a gastroenterologist. You should do a 24-hour poop sample. We'll test it for fat, for parasites, that kind of thing. But it's understanding where is in the realm of normal or just an acute illness before it goes into a serious condition where now we have to do more of an investigation to figure out why this is consistently going on. The next myth I definitely have to go into is the myth that you need to poop every day. This is a conversation I have weekly. And it's me educating patients to explain that it is not that simple. Basically, the answer to that question is whatever is normal for you within reason. So for example, the range of normal poop can range from like 3 times a day to 3 times a week. That's a pretty big range. What's most important is a change from what is normal to you. So if you're the type of person who goes twice a day and now you're going twice a week, yes, that is abnormal, because it's not normal for you. But if you don't fit the standard or what you think the standard is being 1 time a day, that is perfectly fine. It's acute changes in your bowel habits that we're kind of looking for. But again, there's not a standard, and that standard, again, is a very wide range. So you don't have to look for the perfect poop. And if it changes momentarily, like you're going once a day and then one day you go 3 times a day and it goes back to once a day, perfectly fine. So another thing I would say is, like, some people do get super meticulous and they're trying to weigh themselves, but that's really inaccurate. It's extremely hard. The only patients I can think of where we would tell them to weigh themselves daily would be somebody with heart failure, and we're checking their water, like how much water they're taking in, how much water they're taking out, and making sure that they have like a good balance. But for your feces, it doesn't really make sense because your weight can fluctuate. I don't know, 5 pounds up, 5 pounds down, like over a day. If you're tracking yourself from month to month, it might make more sense, but trying to relate that to how much stool you're passing doesn't really make sense and is not that accurate. And again, a lot of that's going to be water content, how much you're breathing, how hot it is outside, the temperature in the room, all that kind of stuff. So I wouldn't fixate on trying to measure your poop. I mean, if you're going to be that meticulous, you might want to get one of those $10,000 Japanese toilets at that point. So just give you a few cures about constipation. I mean, diarrhea, like I said, if it self-resolves within a week, you're pretty much fine. But if it goes, again, for a long period of time, yes, you should seek medical attention. For constipation, a lot of remedies I tell people is to increase their water. So if they have a sudden bout of constipation going on for a couple days, my remedy is pretty straightforward. Before people go to the probiotics. So I know that's a hot topic and people love to get on probiotics, and there is a time and place for that. But before I get there, the one thing I would say is, first thing, increase your water intake. I said, whatever you're drinking, drink 500 milliliters to 1 liter daily to help that pass. The second thing is fiber intake. The more fiber you take in, that fiber, once it hits your gut and hits your large intestine, pulls water in, also helps soften your stool. Third thing I would say is to take a stool softener. Again, that helps soften up the stool. If that's not working, yes, there's another thing you can do, be like polyethylene glycol, Miralax, that helps coat your stool and helps it slip out. And then we start getting into like the medications. But for constipation, when you don't need to go to a doctor, these 4 things: water intake, fiber, stool softener, those kind of things. And again, if it's really not working, again, I would say use polyethylene glycol, otherwise known as Miralax. So what is the role for probiotics? Yes, probiotics do help. Why do people need probiotics? Again, we'll you're colonized with bacteria all over. And generally speaking, that bacteria is in certain ratios. So you have all this good bacteria, and what does it do? It helps break down your food. It's a symbiotic relationship with your gut. Your large intestine does hold your stool before it releases, but the bacteria there does help break down different things. One of the ways you can think about it is when somebody is lactose intolerant, it's because they have an inability to break down milk sugars. And when they're breaking down those milk sugars, they produce gas, and that's the bloating that you get from that. My point of this is the bacteria there does help you digest your food or break up your food. That's what your microbiome does. So what happens is sometimes that microbiome can be out of whack. The ratio of good bacteria, bad bacteria can be switched. And that's when you would reach for a probiotic. So what can cause it to be abnormal? Changes in your diet, moving to a different region of the country, or moving to a different country all on its own. Antibiotics, you can think about it. You take an antibiotic, it wipes out a lot of bacteria. Then you get an abnormal ratio of good bacteria and bad bacteria, and therefore things are not working as they're supposed to. So a probiotic will help level set everything moving forward. And that's basically the reason why one should take a probiotic. So overall, that's all I have to say about the perfect poop. There is no such thing. And I think, again, 1 or 2 mishaps is not a reason to run to the hospital. Blood in your stool, 100%. Chronic diarrhea, 100%. Chronic constipation, all that kind of stuff, yes. But the day-to-day small changes, I wouldn't go crazy. It's just understanding there's a time and place for everything. And again, we're humans. There is no perfect model. There is no perfect poop. So you don't have to chase that. I think just having good gut health, knowing when to use water, knowing when you should be worried about things is the most important thing going forward. So until then, don't worry about the Charmin bears. Until then, don't worry about the probiotics. Stay safe. Until next time.